Well, we're carrying on the series of videos on teaching skills, and what I've drawn here is a lesson plan. Now this might look very basic, but just bear with me, because the aim of this series is that I want to talk about things that I found useful when I was learning to teach. And a lesson plan is a really good way to focus your thoughts about what you want to teach. Now this is a very simplified version. Yours can be more detailed than this, especially when you're learning. These are really useful. So I'm going to start with background information. Now this background information will include things like the date and time of the session, the duration, the location where the session is going to be, the students that you're going to be teaching, and the number of students, because the number of students in the group is going to affect the strategies you're going to use. We also want to know the students' stage of training and their background knowledge about the content. And here we can see the content is about the heart. We also want to know the name of the tutor or the teacher, that's you. And make a note of what your previous experience with the group is and what their likely previous knowledge is going to be. Because remember, we can only teach people when we know what they already know. We're developing on from their previous knowledge into new knowledge. You can give a rationale for the inclusion of the session and the timing of the session, because the session should fit into part of a logical sequence. So for example, here we're talking about the heart and the nature of the circulation. After this, it might be reasonable to talk about the respiratory system. Before this, we might have done a lesson on the nature of body tissues or the nature of body systems. So it contextualizes and fits into a scheme of work. And we want the application to the bigger subject. So this is for student nurses, so the application to nursing here could be mentioned. Heart disease is still a leading cause of death, so it's something that we all need to know about. And then think about the equipment that's going to be required. That comes under this column, the aids that are going to be required. Now the key thing about using equipment in teaching is you've got to make sure it works before you go into the session. The number of times I've gone into class and the video doesn't work, or the loudspeaker doesn't work, or there's a power cut, or some aspect of equipment doesn't work, and you've got to make sure that you're familiar with working the equipment to make sure you can work the video or whatever it happens to be. And also here we can talk about the venue and how you want to arrange the venue. So do you want the seats in neat rows, or do you want them clustered for group discussion? Think about how you're going to lay out your classroom. And here, of course, we can also have the aims and objectives of the session. So this will give us the outcomes. If we know the aims and objectives, that tells us the outcomes that we want to achieve. And it's these learning outcomes, the aims and objectives, that are going to inform the content. So we want to have a logical sequence in this lesson plan, so we don't have any major omissions. And we've got a strategy, we've got a way forward that we want to teach it. Now the lesson plan is related to the subject notes, it's related to the subject matter, but this is as well as the subject matter. So if you're not completely familiar with the content here, then you'll need notes that are going to help you with that process, with that remembering the actual content of the material. If you're more experienced and you've taught it before, then you'll probably know the subject matter already. So we want teaching and learning strategies because we don't want boredom, and we do want effective learning. So what we've got here is we've got the times and we've got the content down this column. This is the content here. Now this is very simplified, as I've said, so you can see it on one side of a piece of paper. The next thing we look at is the teacher activity. And again, that goes down that column there. Then the student activity goes down this column here. These are the aids that are required. And these are how we're going to collect ongoing feedback on the process of the lesson. So this is about management and strategy as opposed to content. And we can also think about learning styles here as well. That kind of comes into this, the teacher activity. What learning style are we going to use? Or what teaching style are we going to use to adapt to the students' differing learning styles? So we need to identify and produce resources as well prior to going into the lesson. So have you produced the resources that you need? Have you identified them? Have you collected them? For example, we haven't got it on this, but we could be using a quiz, or we could be using handouts. We could be using a wide variety of things to help us. Now, this last column here, I've got feedback. This is about ongoing assessment. Now, assessment can be formative or summative. A formative assessment is assessment that helps us to gauge how the students are getting on and helps us to adapt what we're doing and teaching to their bespoke requirements. Now, the converse of formative is a summative assessment, and this is how we actually give an exam at the end of the course. So this feedback we're looking at here is formative. It's telling us how the students are getting on so that we can feed that back into what we're doing in the lesson. Because if the feedback here, I've got visual feedback here, if the feedback you're getting there is bemusement and the students don't know what you're talking about, and you've misgauged the stage of this lesson, then there's no point going on with the rest of the lesson, because that would be making you teacher-centred. You're going to follow your plan regardless of what happens. Whereas the good teacher is not teacher-centred, the good teacher is student-centred. So if what we're getting here is bemusement, we need to adapt this plan and go back and perhaps teach some lower order concepts that are required first. So really this learning plan that we've got here is tentative, it's provisional. It depends on the ongoing evaluation and feedback that we get from the students as we go along. Now, this shows that we need good preparation for our lessons. So we've got a lesson plan, we've got lesson notes, we've got resources, we've got video clips or whatever it is. So proper presentation or proper preparation promotes presentable performance. That's 1, 2, 3, 4, 5 P's. Proper preparation promotes presentable performance. The converse of that, of course, is poor preparation promotes probable poor performance. So if you're not well prepared, you're probably going to perform poorly. So that's 1, 2, 3, 4, that's 6 P's. So remember, poor preparation promotes probable poor performance. Although some people don't say probable poor performance, they use a stronger aspect of phraseology in that sentence. So, what do we need? Get it all together, do the preparation. Now this is very simplified here. This is just an illustrative example really, but from 9 to 9:05, introduction to what we're going to teach. We might tell the students about the aims and objectives at that stage and where this fits into the programme that the students are on. And we can just talk to them about that and the students can listen. But we can use a PowerPoint if you want to make some points. And as we've said, we are watching the students to see how they are receiving this material, to see if they are assimilating this material into their cognitive frameworks. And then this lesson is on heart anatomy, so that is the content. So I need to make sure I've learnt that before the lesson or I've got thorough notes on it. And I think what I'll do is I'll draw a diagram. And I'll draw a diagram on the whiteboard. So I'm going to need a whiteboard and different coloured pens. And I'm going to ask the student to produce their own diagram. That's the student activity. And as I do this, I'll be looking at the students to get visual and verbal feedback, because I'll be talking to the students and asking questions. Then we want to talk about blood flow to the heart, 9:30 to 9:40. And here we'll develop the diagram. I'll probably draw arrows on it to represent the blood flow. And the students will add to their own diagram. It's a developmental process. And again, we need the whiteboard. And in this situation, the teacher can walk around the class looking at the students' diagrams to make sure they understand. Don't be stuck at the front of the class with the students stuck behind a great big desk. You can wander around and look at their diagrams, and that will give you feedback into how the session is going. More content on heart anatomy and physiology. Again, we've said the teacher here can go around the students to see how they're getting on. Now, what I've noticed here is we started at 9 and we've gone to 9:40, so that's 40 minutes. That's a long time to concentrate, actually. That's probably too long, but we won't go any further. So what's a good idea here is to say to the students, well, teach each other what you've learned so far. Recap this material. And this gives the students time to chat to each other. So what this means is they've got different activities. So the student starts off listening, then they produce their own diagram, then they add to the diagram, then they're talking to their next door neighbour and talking to a small group. So the student activity is constantly changing. Otherwise they're going to get bored. If we have teacher talking and student listening all the time, then the students are going to completely turn off. And here we've got some verbal learning. We've got some kind of experiential learning in a sense, because the students are working on their own diagrams, adding to their own diagrams. So this is visual here, isn't it? And here we've got social interaction. And then getting towards the end of this session, this is just over an hour, this session. It's an introduction to the heart. I'm going to play one of the amazing video clips that you can get now on how the heart actually functions. There's MRIs available, there's open heart surgery videos available, so we can play the video. The students can watch the video. Of course, we have to have the equipment, we have to make sure the equipment works, we have to make sure the sound is working all before we start the lesson. And when we're playing a video, especially if it's this is an anatomical video, so we want to keep an eye on the students, make sure they're okay. So when the video is playing, the teacher will probably be already familiar with what is on the video, so the teacher can spend their time watching the students rather than watching the video. And that will also give you feedback to make sure that they're concentrating and to make sure that if you can learn to see the degree to which they're understanding the material and make sure they're happy with the material. So as I say, there's a very simplified lesson plan here. But when I was learning to teach, I found these immensely useful, especially thinking about the timings, the content, what I'm going to be doing, what the students are going to be doing, the age required and the feedback you're going to get. Now, there's no absolute correct way to do this. There's different ways, but this is the way I found worked with these very simple headings. And then you can add detail. Then, of course, when you've done the lesson once, you want to go back and amend this, because teaching is very much about ongoing development of your skills. So the idea is that we are bringing the students up to our level of understanding. And I'm just going to close this brief talk on lesson planning with this great diagram or this great cartoon from David Werner. You might recognise David Werner. He wrote the Where There Is No Doctor series of books. Now this is about healthcare, but it can apply equally to teaching. Here we have the doctor, and the patient, or the learner in our case, is in the pit of ignorance. It's not us casting down medication or casting down knowledge. It's rather us as the teacher helping the student up to our level. There's no hierarchy here. The only difference between me and my students is that I've previously learnt this material. Sometimes that's because I'm older than my students, I'm more experienced, but not necessarily so. But the only difference is that I'm familiar with some material that they want to become familiar with, and we share this together. It is a combination. It is the teacher and the student working in harmony to facilitate a learning process which is beneficial and hopefully enjoyable. If you're enjoying the session, if you're enjoying your teaching, then it's more than likely that the students are also benefiting, enjoying and learning.